Some Deschutes County agencies say there's been an uptick in calls related to mental health crises since the COVID-19 pandemic began. Rhea Piniella explains.
Whether you've been laid off from work or trying to help your children with distance learning or simply trying to put food on the table, it's no surprise that COVID-19 has taken a toll on everyone's mental health. The director of Deschutes County Behavioral Health, Janice Garceau, says mental health-related calls have gone up since the COVID-19 pandemic began. According to Garceau, calls to Deschutes County's Mobile Crisis Assessment Team, or MCAT, have increased by 32% since February, and all 911 mental health-related calls have increased by roughly 13%.
During times of distress like these, where there's increased unemployment, perhaps increased isolation, or very stressful things happening in the news, people tend to have an increase in mental health symptoms.
And these concerns do not only affect adults. Garceau says with children being away from schools and not being able to see a doctor, there's also been a decrease in child welfare referrals.
And often those are the entities that identify when a child is struggling.
To learn more, I spoke with Robin Antonsen, who works with a kids center, Central Oregon's only child abuse intervention center.
With the pandemic and the stay-at-home factors, you obviously have less eyes and ears on children, less trusted adults for children to speak to, primarily in the schools, and so it's just much harder.
Antonsen says added stressors due to COVID include food insecurity and financial instability. She says there's been a 30 to 35% decrease in child welfare referrals since this time of the year last year. And she says child and family therapy sessions have nearly doubled. For more information about mental health resources in Central Oregon, visit the Let's Talk page on our website at ktvz.com. In Bend, Rhea Piniella, News Channel 21.